Question 1. Which pathophysiological mechanism primarily leads to the development of prerenal acute kidney injury, AKI? A. Glomerular damage resulting in proteinuria. B. Decreased renal blood flow leading to ischemia. C. Direct injury to renal tubular cells. D. Interruption of renal autoregulation via electrolyte imbalances. Answer. B. Decreased renal blood flow leading to ischemia. Rationale. Prerenal AKI is primarily caused by a decrease in renal blood flow, leading to ischemia. This can result from factors like dehydration, blood loss, or heart failure, which reduce perfusion to the kidneys. Glomerular damage and tubular injury are typically associated with intrinsic AKI. Question 2. A patient with a urinary tract infection, UTI, is also diagnosed with sepsis. Which of the following findings should be considered an early indicator of septic shock in this patient? A. Hypotension unresponsive to fluids, tachycardia. B. Fever followed by bradycardia. C. Cyanosis of the extremities, oliguria. D. Increased blood pressure with normal respiratory rate. Answer. A. Hypotension unresponsive to fluids, tachycardia. Rationale. In septic shock, hypotension that does not respond to fluid resuscitation and an elevated heart rate, tachycardia, are key early indicators. Sepsis can lead to vasodilation and capillary leakage, causing hypotension. The other options reflect later-stage shock symptoms or unrelated conditions. Question 3. A nurse is caring for a patient with nephrotic syndrome. Which of the following laboratory findings would be most concerning? A. Serum potassium 3.2 milliequivalent per liter. B. Serum albumin 2.5 gram per deciliter. C. Hemoglobin 13.2 gram per deciliter. D. White blood cell count 10,000 per cubic millimeter. Answer. B. Serum albumin 2.5 gram per deciliter. Rationale. Nephrotic syndrome is characterized by significant proteinuria, which leads to low serum albumin levels. A level of 2.5 gram per deciliter is indicative of hypoalbuminemia, which can lead to edema and other complications. The other values are either within normal range or not directly related to nephrotic syndrome. Question 4. In a patient with chronic kidney disease, CKD, which of the following conditions is most likely to cause metabolic acidosis? A. Hyperkalemia. B. Increased urea levels. C. Impaired ammonia secretion. D. Elevated calcium levels. Answer. C. Impaired ammonia secretion. Rationale. Impaired ammonia secretion in CKD results in the kidney's inability to excrete acid effectively, leading to metabolic acidosis. High potassium levels, hyperkalemia, are a common electrolyte imbalance in CKD, but do not directly cause metabolic acidosis. Question 5. A patient with a history of hypertension presents with acute renal failure and hematuria. What is the most likely underlying cause of their renal impairment? A. Renal artery stenosis. B. Hypertensive nephropathy. C. Polycystic kidney disease. D. Glomerulonephritis. Answer. B. Hypertensive nephropathy. Rationale. Chronic hypertension can lead to hypertensive nephropathy, which results in glomerular injury and hematuria. This is a common cause of renal failure in patients with long-standing, uncontrolled hypertension. Renal artery stenosis, polycystic kidney disease, and glomerulonephritis can also cause renal failure, but are less likely in this scenario. Question 6. A nurse is preparing to administer a loop diuretic to a patient with acute heart failure. Which of the following laboratory findings requires immediate action before administration? A. Serum sodium 132 milliequivalent per liter. B. Serum potassium 3.0 milliequivalent per liter. C. Serum creatinine 1.2 milligrams per deciliter. D. Blood urea nitrogen, BUN, 18 milligrams per deciliter. Answer. B. Serum potassium 3.0 milliequivalent per liter. Rationale. Loop diuretics can cause potassium loss, and a low serum potassium level of 3.0 milliequivalent per liter is already dangerously low. Administering a diuretic could lead to severe hypokalemia and potential arrhythmias. Other laboratory values do not indicate immediate concern. Question 7. What is the most appropriate nursing intervention for a patient with acute kidney injury, AKI, who is developing fluid overload? A. Restrict sodium intake to less than 500 milligrams per day. B. Initiate intravenous sodium bicarbonate therapy. C. Initiate hemodialysis for fluid removal. D. Encourage high-protein, low-calorie diet. Answer: C. Initiate hemodialysis for fluid removal. Rationale: in AKI with fluid overload, hemodialysis is the most effective way to rapidly remove excess fluids and waste products. Restricting sodium or administering sodium bicarbonate is not sufficient in managing fluid overload in AKI. Question 8. In the management of patients with renal artery stenosis, which pharmacological intervention is most likely to be beneficial in controlling hypertension? A. ACE inhibitors. B. Diuretics. C. Beta blockers. D. Calcium channel blockers. Answer: A. ACE inhibitors. Rationale: ACE inhibitors are effective in reducing blood pressure and protecting renal function in patients with renal artery stenosis. They work by dilating blood vessels, which helps reduce the pressure in the kidneys. Diuretics, beta blockers, and calcium channel blockers are less effective in this specific condition. Question 9. A patient with urinary retention is prescribed bethanechol uricholine. What is the primary action of this medication? A. It inhibits acetylcholine at muscarinic receptors. B. It stimulates muscarinic receptors to promote bladder contraction. C. It promotes the excretion of sodium and water. D. It relaxes the detrusor muscle of the bladder. Answer: B. It stimulates muscarinic receptors to promote bladder contraction. Rationale: bethanechol is a cholinergic agent that stimulates muscarinic receptors in the bladder, which promotes contraction and facilitates urination. It is used to treat urinary retention. The other options are incorrect actions of the drug. Question 10. A patient presents with hematuria, proteinuria, and edema. What is the most likely diagnosis based on these symptoms? A. Acute glomerulonephritis. B. Urinary tract infection UTI. C. Chronic kidney disease CKD. D. Polycystic kidney disease PKD. Answer: A. Acute glomerulonephritis. Rationale: acute glomerulonephritis is characterized by hematuria, proteinuria, and edema due to glomerular inflammation. The other conditions may present with some of these symptoms, but are not as closely associated with all three. Question 11. In a patient with diabetic nephropathy, which of the following interventions is most likely to slow the progression of kidney disease? A. Angiotensin-converting enzyme ACE inhibitors. B. High-protein diet. C. Furosemide therapy. D. Oral corticosteroids. Answer: A. Angiotensin-converting enzyme ACE inhibitors. Rationale: ACE inhibitors are known to slow the progression of diabetic nephropathy by reducing proteinuria and protecting the kidneys from further damage. A high-protein diet and corticosteroids are not recommended in this condition. Question 12. A nurse is caring for a patient with suspected bladder cancer. Which of the following findings would be most indicative of this condition? A. Hematuria without pain. B. Painful urination and fever. C. Urinary frequency with incontinence. D. Flank pain and fever. Answer: A. Hematuria without pain. Rationale: hematuria, blood in the urine, without pain is a common symptom of bladder cancer. The other symptoms are more typical of urinary tract infections or other bladder conditions. Question 13. A patient with chronic kidney disease CKD is undergoing peritoneal dialysis. Which of the following complications is most likely to occur during this procedure? A. Air embolism. B. Peritonitis. C. Bleeding from the catheter site. D. Hypokalemia. Answer: B. Peritonitis. Rationale: peritonitis is a common and serious complication of peritoneal dialysis caused by infection of the peritoneal cavity. It can occur if the dialysis system is contaminated. Question 14. A nurse is caring for a patient with nephrotic syndrome who is receiving corticosteroid therapy. What is the most important aspect of care during this treatment? A. Monitor for signs of infection. B. Monitor for signs of hyperkalemia. C. Encourage a low-sodium diet. D. Increase fluid intake to prevent dehydration. Answer: A. Monitor for signs of infection. Rationale: corticosteroids suppress the immune system, increasing the patient's risk of infection. Monitoring for signs of infection is critical during this therapy. The other options are less relevant to corticosteroid therapy. Question 15. Which of the following is a common finding in a urinalysis of a patient with nephrotic syndrome? A. Pyuria and bacteriuria. B. Proteinuria and lipiduria. C. Hematuria and increased specific gravity. D. Ketones and glucose. Answer: B. Proteinuria and lipiduria. Rationale: nephrotic syndrome is characterized by significant protein loss in the urine, proteinuria, and often lipiduria, presence of lipids in urine. Pyuria, pus in urine, is more typical of an infection. Question 16. A nurse is teaching a patient about the prevention of urinary tract infections, UTIs. Which of the following statements should the nurse include? A. Drink cranberry juice regularly. B. Avoid drinking large amounts of water. C. Wipe from back to front after using the toilet. D. Use scented feminine hygiene products regularly. Answer: A. Drink cranberry juice regularly. Rationale: cranberry juice is believed to prevent UTIs by preventing bacteria from adhering to the urinary tract. The other statements either promote practices that increase UTI risk, for example wiping back to front or using scented products, or are not helpful, for example restricting water intake. Question 17. A patient with acute pyelonephritis is prescribed antibiotics. What is the most important nursing intervention during the initial treatment phase? A. Monitor for signs of sepsis. B. Encourage high fluid intake. C. Administer analgesics for pain management. D. Limit ambulation to prevent further infection. Answer: A. Monitor for signs of sepsis. Rationale: pyelonephritis can lead to sepsis, a life-threatening condition, especially in severe cases. Monitoring for sepsis is critical. Fluid intake, pain management, and ambulation are also important, but secondary in this phase. Question 18. Which of the following is the primary goal in the management of a patient with end-stage renal disease, ESRD, undergoing hemodialysis? A. Correct hyperkalemia. B. Maintain fluid and electrolyte balance. C. Increase erythropoietin production. D. Prevent urinary retention. Answer: B. Maintain fluid and electrolyte balance. Rationale: in ESRD, hemodialysis aims to maintain fluid and electrolyte balance by removing waste products and excess fluid. While hyperkalemia and erythropoietin deficiency are also concerns, the primary goal is balance. Question 19. Which intervention should be prioritized for a patient with severe urinary retention and bladder distension? A. Apply a heating pad to the lower abdomen. B. Insert a urinary catheter to relieve retention. C. Administer a diuretic to increase urine output. D. Provide a stool softener to prevent constipation. Answer: B. Insert a urinary catheter to relieve retention. Rationale: in severe urinary retention with bladder distension, catheterization is necessary to relieve the pressure and prevent further complications like bladder rupture. The other interventions are less urgent or unrelated to immediate retention relief. Question 20. A nurse is preparing to administer a dose of furosemide Lasix to a patient with heart failure. Which lab result should the nurse check before administration? A. Serum creatinine. B. Serum albumin. C. Serum potassium. D. White blood cell count. Answer: C. Serum potassium. Rationale: furosemide is a loop diuretic that can cause potassium loss. Checking the serum potassium level is essential to avoid hypokalemia, which can lead to dangerous arrhythmias. Serum creatinine is also important to assess renal function, but is not as critical for diuretic use. Question 21. A patient with a history of hypertension and diabetes presents with worsening chronic kidney disease, CKD. Which of the following pathophysiological processes is most responsible for the progression of kidney damage in this patient? A. Glomerular hyperfiltration and increased intraglomerular pressure. B. Accumulation of uremic toxins in the renal tubules. C. Increased capillary permeability leading to proteinuria. D. Hypoperfusion of the renal cortex due to renal artery stenosis. Answer: A. Glomerular hyperfiltration and increased intraglomerular pressure. Rationale: in patients with hypertension and diabetes, glomerular hyperfiltration and increased pressure contribute to kidney damage by causing structural changes in the glomeruli. This leads to progressive nephron damage, worsening CKD. Other options describe secondary effects, but not the primary cause. Question 22. A nurse is caring for a patient with end-stage renal disease, ESRD, who has developed uremic pericarditis. Which of the following findings is most characteristic of this condition? A. Sudden onset of pleuritic chest pain that worsens with deep breathing. B. Diaphoresis and hypotension during dialysis. C. pericardial friction rub and sharp, substernal chest pain. D. Pain in the lower extremities with diminished pulses. Answer: C. Pericardial friction rub and sharp, substernal chest pain. Rationale: uremic pericarditis occurs in ESRD and is characterized by a pericardial friction rub and sharp, substernal chest pain. This results from inflammation of the pericardium due to the accumulation of uremic toxins. Other findings, like pleuritic chest pain, are more indicative of pleuritis or pulmonary issues. Question 23. A patient with nephrotic syndrome is receiving corticosteroid therapy. Which of the following complications should the nurse closely monitor for in this patient? A. Hyperkalemia due to corticosteroid-induced aldosterone secretion. B. Osteoporosis due to prolonged steroid use. C. Acute tubular necrosis due to dehydration. D. Hyperglycemia resulting from steroid-induced insulin resistance. Answer: D. Hyperglycemia resulting from steroid-induced insulin resistance. Rationale: corticosteroids cause insulin resistance, leading to elevated blood glucose levels and potential development of hyperglycemia, especially in patients with nephrotic syndrome. Osteoporosis is also a risk with prolonged steroid use, but is less immediate compared to hyperglycemia. Question 24. A nurse is caring for a patient with a suspected diagnosis of acute tubular necrosis, ATN. What is the most critical finding to assess immediately in this patient? A. Serum sodium levels and urine output. B. Serum potassium levels and ECG changes. C. Blood urea nitrogen, BUN, and creatinine levels. D. Urine specific gravity and protein levels. Answer: B. Serum potassium levels and ECG changes. Rationale: hyperkalemia is a life-threatening complication of ATN, and changes in the ECG, such as peak T waves, can indicate serious electrolyte imbalances. Monitoring for elevated BUN and creatinine is important, but secondary to managing potassium and preventing cardiac arrhythmias. Question 25. A nurse is caring for a patient with polycystic kidney disease, PKD, who has developed an abdominal aortic aneurysm, AAA. Which of the following is the most appropriate course of action? A. Monitor blood pressure closely and avoid heavy lifting. B. Encourage aggressive fluid intake to prevent dehydration. C. Administer beta blockers to decrease systolic blood pressure. D. Initiate hemodialysis to reduce renal stress. Answer: A. Monitor blood pressure closely and avoid heavy lifting. Rationale: in PKD, the risk of an AAA is increased due to the vascular abnormalities associated with the disease. Monitoring blood pressure to prevent rupture and avoiding strain are critical. Beta blockers may be used to control blood pressure, but avoiding physical strain is the most important intervention. Question 26. A patient with chronic kidney disease, CKD, develops metabolic acidosis. Which of the following mechanisms most likely explains the development of this condition in CKD? A. Reduced renal excretion of hydrogen ions and ammonia. B. Increased renal tubular reabsorption of bicarbonate. C. Elevated production of urea by the liver. D. Enhanced excretion of sodium due to glomerular damage. Answer: A. Reduced renal excretion of hydrogen ions and ammonia. Rationale: in CKD, the kidney's ability to excrete hydrogen ions and produce ammonia is impaired, leading to the retention of acid in the body and development of metabolic acidosis. Question 27. A patient receiving hemodialysis has developed a fever, hypotension, and chills. Which condition is most likely causing these symptoms? A. Peritoneal dialysis-associated peritonitis. B. Catheter-related bloodstream infection, CRBSI. C. Dialysis disequilibrium syndrome. D. Acute glomerulonephritis. Answer: B. Catheter-related bloodstream infection, CRBSI. Rationale: fever, hypotension, and chills during hemodialysis are typical symptoms of a catheter-related bloodstream infection. This is a serious complication and requires immediate intervention. Dialysis disequilibrium syndrome can occur, but usually presents with neurologic symptoms. Question 28. A nurse is caring for a patient with a history of renal artery stenosis and uncontrolled hypertension. Which of the following is the most effective pharmacological intervention to reduce blood pressure in this patient? A. ACE inhibitors. B. Calcium channel blockers. C. Diuretics. D. Beta blockers. Answer: A. ACE inhibitors. Rationale: ACE inhibitors are most effective in reducing blood pressure and protecting renal function in patients with renal artery stenosis. They dilate the efferent arterioles in the kidney, reducing glomerular pressure and improving blood flow. Question 29. A nurse is educating a patient with newly diagnosed nephrotic syndrome about dietary management. Which of the following recommendations is most important? A. Restrict protein intake to prevent further kidney damage. B. Limit sodium intake to control edema. C. Increase potassium intake to correct metabolic acidosis. D. Avoid calcium supplements to prevent renal calculi. Answer. B. Limit sodium intake to control edema. Rationale. The most important dietary modification for nephrotic syndrome is limiting sodium to help manage edema. Protein intake may need to be restricted, but not as immediately as sodium. Potassium and calcium issues are less directly related. Question 30. A patient with diabetic nephropathy is receiving an angiotensin-converting enzyme ACE inhibitor. Which of the following is the most important adverse effect to monitor for during therapy? A. Hyperkalemia. B. Hypoglycemia. C. Elevated creatinine. D. Hypotension. Answer. A. Hyperkalemia. Rationale. ACE inhibitors can cause hyperkalemia, especially in patients with diabetic nephropathy due to their effect on the kidneys. Monitoring potassium levels is crucial to prevent life-threatening cardiac arrhythmias. Question 31. A patient with acute glomerulonephritis is experiencing decreased urine output and severe fluid retention. Which of the following is the most appropriate nursing intervention? A. Initiate a fluid restriction and monitor daily weights. B. Encourage high-protein foods to enhance glomerular filtration. C. Administer intravenous diuretics to promote urine output. D. Perform bladder irrigation to prevent infection. Answer. A. Initiate a fluid restriction and monitor daily weights. Rationale. Fluid retention is common in acute glomerulonephritis, and the most important intervention is to restrict fluid intake and monitor weight for signs of worsening fluid overload. Diuretics may be used later, but are not the first step. Question 32. A patient undergoing peritoneal dialysis presents with cloudy dialysate drainage. Which of the following should the nurse suspect and address first? A. Hypotension. B. Peritonitis. C. Hyperkalemia. D. Electrolyte imbalance. Answer. B. Peritonitis. Rationale. Cloudy dialysate drainage is a classic sign of peritonitis, a serious infection of the peritoneal cavity. It requires immediate intervention with antibiotics to prevent further complications. Question 33. A patient with a history of polycystic kidney disease, PKD, presents with worsening flank pain and fever. What should the nurse assess first? A. Blood pressure and urine output. B. Palpation of the abdomen and flank area. C. Temperature and signs of infection. D. Serum creatinine and BUN levels. Answer. C. Temperature and signs of infection. Rationale. Fever in a patient with PKD may indicate a renal infection or cyst rupture, which requires prompt treatment. While other assessments are important, addressing the possibility of infection is the priority. Question 34. A patient with CKD and a history of hypertension develops sudden-onset oliguria. Which of the following is the most likely cause of this condition? A. Acute tubular necrosis, ATN, due to ischemia. B. Progression of CKD with decreased glomerular filtration. C. Obstruction of the urinary tract by kidney stones. D. Exacerbation of hypertension leading to fluid overload. Answer. A. Acute tubular necrosis, ATN, due to ischemia. Rationale. Oliguria in CKD patients with sudden onset can be due to ATN, especially after ischemic events like hypotension or blood loss, which leads to acute kidney injury. Question 35. A nurse is caring for a patient with a Foley catheter in place for more than 72 hours. Which of the following is the most appropriate intervention to reduce the risk of infection? A. Change the catheter insertion site daily. B. Use sterile technique when performing catheter care. C. Clamp the catheter for several hours each day. D. Administer prophylactic antibiotics as prescribed. Answer. B. Use sterile technique when performing catheter care. Rationale. Using sterile technique for catheter care is the most important measure to reduce the risk of catheter-associated urinary tract infections, UTIs. The other options do not directly reduce infection risk. Question 36. A patient presents with hematuria, proteinuria, and hypertension. The most likely diagnosis is A. Nephrotic syndrome, B. Acute glomerulonephritis, C. Chronic kidney disease, D. Renal artery stenosis. Answer: B. Acute glomerulonephritis. Rationale: hematuria, proteinuria, and hypertension are classic signs of acute glomerulonephritis, which often follows an infection, such as a streptococcal throat infection. Question 37. A patient with nephrolithiasis is experiencing severe flank pain. Which of the following is the most appropriate first-line intervention? A. Administer opioid analgesics for pain management. B. Encourage increased oral fluid intake. C. Apply heat to the lower abdomen to alleviate pain. D. Restrict oral intake to prevent further stone formation. Answer: A. Administer opioid analgesics for pain management. Rationale: severe pain from nephrolithiasis can be managed initially with opioid analgesics. Increased fluid intake and heat application may help with the passage of stones, but pain relief is the immediate priority. Question 38. A nurse is caring for a patient who is receiving dialysis and has developed severe hypotension. Which of the following interventions is most appropriate? A. Administer a vasopressor to increase blood pressure. B. Increase the dialysis flow rate to improve fluid removal. C. Lower the head of the bed to prevent further hypotension. D. Discontinue dialysis and call the physician for guidance. Answer: A. Administer a vasopressor to increase blood pressure. Rationale: severe hypotension during dialysis can result from fluid shifts. Administering a vasopressor is appropriate to maintain blood pressure while addressing the underlying cause. Question 39. A patient with chronic kidney disease, CKD, and hyperkalemia is prescribed sodium polystyrene sulfonate, catheterization. What is the primary action of this medication? A. Promote potassium excretion in the stool. B. Prevent potassium absorption from the gastrointestinal tract. C. Increase renal clearance of potassium through diuresis. D. Bind to calcium and decrease potassium levels. Answer: A. Promote potassium excretion in the stool. Rationale: catheterization is a cation exchange resin that binds to potassium in the intestines, promoting its excretion in the stool. This helps reduce hyperkalemia in CKD patients. Question 40. A patient is being evaluated for renal artery stenosis. Which of the following diagnostic tests is most appropriate for confirming this diagnosis? A. Renal ultrasound with Doppler flow studies. B. Serum creatinine and BUN levels. C. Computed tomography, CT, scan without contrast. D. Magnetic resonance imaging, MRI, of the abdomen. Answer: A. Renal ultrasound with Doppler flow studies. Rationale: renal ultrasound with Doppler studies is the most effective and non-invasive method to evaluate renal artery stenosis by assessing blood flow through the renal arteries. CT or MRI with contrast may be used if further evaluation is needed, but ultrasound is the first-line test. If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.